A warm greetings to everyone. Today we are going to discuss a very important topic in rehabilitation medicine, that is the importance of physiatry in functional diagnosis. So before understanding its importance, let us first understand two key terms, that are physiatry and functional diagnosis. Physiatry is also known as physical medicine and rehabilitation, that means PM&R, is a medical specialty that focuses on restoring function, improving quality of life and reducing disability in patients with physical impairments. So and functional diagnosis is the process of identifying how a disease or injury affects a person's ability to function in daily life rather than just naming the disease. Okay, so these are the two important key terms, and in this slide we are going to discuss difference between medical diagnosis and functional diagnosis. In traditional medical diagnosis, the doctor asks what is the disease, what organ is affected. But in functional diagnosis, the physiatrist asks what activities can the patient perform, what activities are limited, how independent is the patient in daily life. For example, a medical diagnosis may ask stroke. In functional diagnosis explains, can patient walk, can the patient use the hand, can the patient speak, eat or dress independently. So these are the difference between the medical diagnosis and the functional diagnosis. So this shift is focus is where physiatry plays a vital role. Okay, so next we are going to discuss role of physiatry in functional diagnosis. So physiatrists are trained to look at the whole person, not just the disease. Okay, they assess muscle strength, joint mobility, balance and coordination, sensory function, cognitive and psychological status, ability to perform activities of daily living, that means ADL. So thus physiatry helps in understanding how impairments leads to the disability and handicap. Okay, so next we are going to discuss importance of physiatry in functional diagnosis. Now let us understand the important points by point. Okay, so focus on functional ability. So in this case the physiatry emphasizes what the patient can do, not only what they cannot do. Okay, for example, a patient with a spinal cord injury may not walk, but physiatry evaluates wheelchair mobility, self-care skills and vocational ability. This functional approach helps in maximizing independence. So second one, early identification of functional limitations. So here physiatrist identifies functional problems early, even when structural damage appears minimal. For example, early functional diagnosis helps to prevent complication, reduce long-term disability, improve recovery outcomes. So third one, holistic and multidisciplinary assessment. So here physiatry works with physiotherapist, occupational therapist, speech therapist and psychologist, also a social worker. So functional diagnosis is made by combining inputs from all these professionals and get complete picture of the patient's abilities and limitations, so that this holistic and multidisciplinary assessment is very important. So next, goal oriented rehabilitation planning. So physiatry converts functional diagnosis into realistic rehabilitation goals. So goals may be include independent walking, self-feeding, return to work, social participation. Without proper functional diagnosis, rehabilitation goals become unclear or unrealistic. Okay, so that goal oriented rehabilitation planning is very important role in the physiatry. Okay, fifth one, individualized treatment approach. So every patient is different, even if they have the same medical condition. Physiatry ensures personalized rehabilitation plans, customized exercise and assistive devices, patient-centered care. Okay, functional diagnosis guides what type of therapy is required and to do extent. Okay, and to what extent. Okay, so next sixth one, measurement of functional outcomes. So here physiatrists use standardized tools such as functional independence measure, that means FIM, and also ADL and IADL scales. These tools help in tracking progress, modifying treatment plans, evaluating rehabilitation effectiveness. So seventh one, psychological and social consideration. Here functional diagnosis in physiatry includes emotional well-being, well-being, motivation, family support, social and vocational issues. So this is important because psychological health directly affects functional recovery. Okay, so that this is important one. Next 8 one, prevention of secondary disabilities. Here is the physiatry plays the vital role because physiatry needs to identify how to avoid the secondary disabilities of the particular person, because physiatry helps prevent so muscle contractures, pressure sources, so joint stiffness, depression. Early functional diagnosis allows timely interventions to avoid the secondary complications, so that physiatry plays the vital role in the rehabilitation team. Okay, so now we will discuss some clinical example. Let us take a simple example, a patient with lower limb fracture. In medical diagnosis, fracture identified this is the fracture. During functional diagnosis, physiatry identifies difficulty in walking, inability to climb stairs, dependence in toileting and bathing. Based on this, rehabilitation is planned to restore mobility and independence, not just bone healing. Okay, so here physiatry planning the total rehabilitation therapies to restore the mobility, so that here physiatry is very important in rehabilitation team. Physiatry plays a central role in functional diagnosis by shifting the focus from disease to function, independence and quality of life. Functional diagnosis bridges the gap between medical treatment and real life functioning, so forms the foundation of effective rehabilitation, ensures holistic patient-centered care. Hence, physiatry is essential for accurate functional diagnosis and successful rehabilitation outcome. This diagram explains how a person's functional ability changes over time due to disease, disability and rehabilitation. It clearly shows why rehabilitation is as important as medical treatment and what happens when rehabilitation is either provided or denied. Okay, so first we will understand the axis of the diagram. X-axis is time, so represents the progression of a person's life or illness, okay, over a time. So starts from onset of disease and continues through recovery or long-term disability. In Y-axis, level of functional independence is available. This axis shows how independent or dependent a person is in daily life. From bottom to top, okay, total dependent, so that means needs full assistance for all activities. Next, partially dependent, that means needs help for some activities. So next, partially dependent, so in this can perform many activities with minor help. So fourth one, self dependent, in that completely independent. Okay, so optimal health means the maximum physical, mental and social functioning. So this is the y-axis. So here normal health state is the optimal. Top of the graph we see optimal health. The person is self dependent and fully functional. Okay, this is the ideal condition before disease occurs. Okay, so onset of disease, the sharp downward curve labeled disease indicates here. So sudden illness, injury or trauma, for example stroke, it may be spinal cord injury or accident. Okay, yes, disease occurs, functional ability rapidly declines. Okay, the person may move from self dependent to partial dependent or totally dependent. Okay, so medical treatment alone does not guarantee restoration of functions. Okay, if disease affects movement, sensation or self-care, the person enters a state disability. Okay, person enters a state disability. This is shown in the lower portion of the graph. Disability leads to reduced independence, increased dependency on family or caregivers. So two possible pathways after the disability, so that is rehabilitation denied and rehabilitation provided. So there are two pathways are available. So first pathway, rehabilitation denied. Okay, if the lower curved line represents the rehabilitation not provided, the person may show slightly natural recovery but never reaches full independence. Over time, functional level declines again. person remains partially or totally dependent throughout life. So without rehabilitation, disability becomes permanent, quality of life reduces, long term burden increases on family and society. Okay, so pathway to rehabilitation services provided once. Okay, so that describes so the upper curve shows yearly and continuous rehabilitation. So with rehabilitation, functional ability gradually improves. So the person moves from total dependent to partially dependent to the partially independent to the self-dependent. Eventually, the person reaches near optimal or optimal health. Okay, so maintains independence for a longer period. So rehabilitation restores function, not just survival. Okay, now we will see the role of physiatry and rehabilitation. The diagram emphasizes the importance of physiatrists, physiotherapist, occupational therapist, okay, speech therapist, rehabilitation engineers, assistive technology. Together they reduce disability, improve independence, enhances the participation in society. So now we will discuss some key takeaways. Okay, disease leads to disability, but disability is not permanent if managed correctly. Rehabilitation bridges the gap between illness and independence. Also, early rehabilitation prevents long-term dependence, secondary complication. Rehabilitation focuses on function, participation, also quality of life. Okay, so this diagram clearly proves the rehabilitation is not optimal. It is essential medical treatment, saves life, but rehabilitation gives lives back its meaning by restoring independence. Okay, I hope you all understand the concept. Thank you so much for your patience for watching this video. Thank you so much.